So we have a problem, and that's why the World Health Organization Director General said the clock is ticking. 2030 is how many years away? Virtually 6 years. And yet we are grappling with 1.3 million dying and over 350 million people with this condition. And worst of it is, every single day, about over 3,000 people die. Every single day. Can you imagine this? And like Doctor has said, every 30 seconds, somebody dies. But if you calculate, if you convert those seconds into minutes, into days, so every day over 3,000 people die as a result of this very disturbing virus. But there is light at the end of the tunnel. Why are we to say this? Because we have the tools. We have the ammunition to fight. We are soldiers. We are ready to fight. So the ammunition is there. Once the ammunition is at the disposal of a soldier, obviously the sky is the limit. So we also have our ammunition. The ammunition is first the knowledge. Like previous speakers have said, let's educate ourselves. And let's educate our families. Let's educate our friends. Let's educate our colleagues. Let's educate the public so that they are aware of this condition. Once they know, we'll be able to do something. And of course, we know that we have made progress in preventing, in curing, in treating, and of course in immunizing. But these achievements fall far too short for what the global community wants. Because as we speak now, Doctor is saying about immunization. The world, as we speak globally, only 45% of our babies receive the hepatitis vaccination within 24 hours of delivery. Dr. Peter has mentioned within 20. So where is the 60? I mean, 55%. This is globally. The picture, the situation may be different from country to country, but this is where we are. 45% of only 45% of babies receive hepatitis vaccination within 24 hours delivery. The rest, either they don't have it or they receive it very late. And you all know the consequences of receiving the vaccine very late. So that's why we are faring with the problem. And 80% of those with this, people with these conditions, they don't have the treatment they need. So it's only 20% that may have the treatment. 80% they don't have. That's what the World Health Organization says. 80% of people with this condition, they don't have any treatment, meaning that they are going to die slowly, as Dr. Bide has mentioned. In conclusion, what Dr. again wants to say is, she thanks the Ministry of Health very much for the leadership, for the commitment. Two things. The Gambia's immunization program is a solid example for this African region. The Gambia has excelled in immunization way back in the 1970s. When some of us were still going to school, the Gambia started this immunization EPI program, expanded program on immunization. So the Gambia is one of the, if you want to cite good examples, success stories, best practice in the African region, Gambia is one of them. And he also wants to thank the same ministry by, translating that political commitment into establishing a whole directorate. This has never happened in this country. all I know. We are having program directors for, but hepatitis, to have a whole directorate for hepatitis program, I think this is commendable. It's a commendable effort that the WHO is recognizing, and we are very grateful to the ministry. We applaud the ministry for this. So this tells us that there is already the political will in this country to tackle this very bad disease, very unforgiving. But again, as Dr. Jane says, we need collective action. We need collective. No single institution can do it alone. Of course, the World Health Organization will be ready, or is always ready, to rally behind the Minister of Health, to give it all the ammunition, all the necessary evidence that they need, the tools that they need to be able to fight this menace. Yes, the World Health Organization will continue to do that. But that is not enough until everybody participates, until everybody, we all come together to fight this very #1 enemy of all of us, a disease that has no mercy. So we need to really work together to fight this menace. On that note, Dr. Jane wants to thank the people of the Gambia, and of course the government and people of the Gambia, for the exemplary, for the government leadership, and exemplary leadership, but for the communities for being so receptive. Our communities are doing a lot. We have to thank them. That is why the immunization coverage of the Gambia is high. If the communities are reluctant, we will not get there. So we have to singularly thank the communities of the Gambia for their excellent participation in immunization services. On that note, I thank you very much on behalf of the team. God bless you. Thank you.
Every minute we lose 2 people. This is an urgent priority. And it does not have to be so. Most of those who die from viral hepatitis die because they did not know their status. As the previous speakers have said, less than 1 in 10 people who are living with viral hepatitis know that they have the infection. And because they do not know their condition, they are unable to seek help. And help is available. The most important viral hepatitis diseases are hepatitis B and C. For hepatitis C, there is an easy test and there is a cure that someone will take for only 3 months and they can eliminate the virus. For hepatitis B, there is a test that you do which only requires a finger prick. So even for those who are afraid of needles, you can still do the test. Your results are available immediately. We have a booth there where we are offering the test today. And for those who have hepatitis B, there is a treatment that is very effective that can prevent people from dying. And for those who do not have hepatitis B, there is a vaccine that prevents people from having the disease. And the vaccine is available everywhere in the Gambia and is given as soon as after birth onwards through the EPI programs. So if we have all of these, then why is hepatitis still killing people every 30 seconds? That is because the tools we have to combat the disease is not available to people. The second reason is we do not know about these diseases. If we ask people sitting here today anything about malaria, tuberculosis, HIV, COVID, every single person will be able to say something about these diseases. Hepatitis affects more people in the Gambia than these other diseases, but we do not know about it. So because of the poor awareness, because the tools are not available where they should be available, people continue to die. And that is why the theme for this year is important. It says it is time for action. So what does action look like? For you and me, action starts by us trying to know something about viral hepatitis and teaching the next person what we've learned about it. The information is available through our healthcare providers, through the Ministry of Health, through other resources. We should all make it our commitment to learn about viral hepatitis and make sure that our families, our friends, our colleagues at work know about it. People know where to get help. People know how to prevent themselves and their loved ones. The other thing we need to do is make sure that viral hepatitis services are integrated within the services that people normally access. We do not need dedicated specialist clinics like what we have at the MRC or the teaching hospital for viral hepatitis. You should be able to go to any health center in the country and get tested and get prevention services. We need to integrate. But these are more high-level actions that the Ministry of Health is working on. But coming back to us, what can we do? The first thing is to make sure that we know about hepatitis and pass the message on. The second thing is we know our status. Each one of us needs to make sure that they get tested, because if you have either of the two viral hepatitises, there is help that you can get that could save your life. The third thing, and this time I am talking to the employers, we need to end the stigma against hepatitis. Viral hepatitis, yes, is a deadly disease, but 9 out of 10 individuals who have the virus will live with it and die with it without any problems. Yes, it is contagious, but it is not passed through handshakes or sitting next to someone in an office. Therefore, it is not and should not be an exclusion criteria for employers. So we urge all employers in the Gambia and beyond, it is good to have health screenings before you employ individuals, but those who have viral hepatitis should be provided support but not be excluded from employment opportunities. And we call on the powers here, the World Health Organization, the Foreign Affairs Ministry, and the other ministries to also engage international powers and governments at the highest levels to remove viral hepatitis from the exclusion criteria for travel, for scholarships, and other opportunities, because this only harms people more. As Dr. Jaju has said, the military excludes soldiers from their deployment services if they're hepatitis B or C positive. And this would make the soldiers to not want to be tested. If people don't get tested, they don't get the help they need, and that increases their risk of dying from this. And finally, to wrap up, I want to urge for employers, and especially the private sector in the country, to support the stakeholders, to support the Ministry of Health and the government in terms of providing domestic financing for viral hepatitis services. The tests are available, the treatment is available, but it is not free. And hepatitis affects some of the poorest individuals in our community who cannot afford these things otherwise. So I call on the private sector, let one of you or more of you come up and be the viral hepatitis champion for the country. You cannot save more lives by investing in any other condition in the Gambia than you will through viral hepatitis. I thank you all.
Practicing as a hepatologist for the past 10 years, and I've seen more than 1,000 people dying of hepatitis-related complications. And these are people who came to our clinic, and they told me, Dr. Bite, do everything to save my life. And I think about them and I say, we'll do our best. But unfortunately, our best is not enough. Because at the end of the day, our best we will do, but they will die. So imagine within 10 years, 1,000 people actually died. Imagine in a family, you have a brother who comes to us with liver cancer. And 5 years down the line, another elder brother also comes. And this is not once, this is not twice, this is not 3 times, this is not 4 times. So what you have is like, you have 2 or 3 people within one family dying of hepatitis-related complication. You also have, I will give you a story. The first patient that was seen at MRC, at our clinic in MRC, when I was working there, was an old man. And this old man has a picture, because this picture was actually taken by Prof. Yai. So, Prof. Yai, who is our head, she took the picture with him. 5 years down the line, he has a unique surname. And because of that unique surname, our nurses and field workers were able to identify the unique surname. So the son came in to our clinic with that unique surname. And what the field worker did was, do you know, she went to the picture and asked this individual, do you know this man? He said, yes, this is my father. So you imagine what was happening in that patient's mind. The third thing also, we had an uncle and a nephew coming to our clinic the same day. And the same day because they have hepatitis-related complication. They had liver cancer. So imagine an uncle and a nephew coming on the same day, and they are from the same compound, and they didn't know that they were going to meet in that clinic. And they came and met in that clinic. So imagine what would happen if one of them dies. The other would also think that I'm also going to die. So if you have 1,000 people, this is just our clinic. So you think about other people who are actually dying in the other health facilities. You think about those who are dying in Edward Francis Small Teaching Hospital on admission. So, how many people are actually dying in the Gambia? It's uncountable. Just think about it in your own family. How many of us have had people who actually died? And when they died, when they were dying, what they complained of was they had an abdominal distension. They were complaining about abdominal pain and abdominal distension. So it's almost everybody, every family. Almost every family. If I ask questions here, almost everybody will say, yes, I could remember my this, my that, my that. So what it means is, every family in this Gambia is either directly affected or indirectly affected. I agree with what Dr. Dow has said. If you look at the mortality in EFSTH, liver-related complications, hepatitis-related complications are much more, much more than those who actually die from malaria, from TB, or from HIV. So this is why, for me, this time bomb has exploded. There is nothing like waiting anymore. We cannot actually wait. And those of us in the clinic know it. Because these are people who come to me and tell me, Dr. Peter saved my life. And I cannot save their life. So this is the message for those who have actually died. And this message, I'm transmitting this information to all the stakeholders here. Whether it's government, whether it's private sector, whether it's WHO, whether all institutions in the Gambia are actually affected. WHO had somebody who actually died of liver cancer. Sirif, I've never told you, but a staff who was actually posted to your unit actually died of liver cancer. You may not know because that was at the beginning. But this staff was posted in your unit, National Hepatitis Control Program, and this staff also died. So it means all institutions are affected. WHO is affected because I know somebody who came from WHO. So there is no institution here in this Gambia that does not have somebody who died of liver cancer. There is none. Because I can attest to that, because I've written reports. The ministers will call me and say, Dr. Bide, please, my niece is coming, can you help? Directors will call me and say, Dr. Bide, please, my niece is coming, please help. National Assembly members will call and say, Dr. Bide, please, help. This is how serious the situation is. For me, the time bomb has actually exploded. We have missed the train. But I think we can still try our level best as much as possible. With the coming of the National Hepatitis Control Program, as I told you just now, Sirif, even your unit is actually affected. Your unit is actually affected. This I've never told you, but it is. There is no ministry in this Gambia that does not have anybody who has it. There is no private sector, whether it's ports, whether it's NAWEC, whether it's GAMTEL, whether it's GAMCEL, whether it's Central Bank, whether it's GT Bank, whether it's Trust Bank, all the banks, name them. This is what has been happening for the past 10 years, and we can't continue like this. We must do something. So today, as I said, I have to speak for the dead. Because the dead have spoken. They have told me, Dr. Bide, do everything to save my life. And what that means is like, they're also telling us that we should do everything to make sure that we save the life of everybody in this Gambia. So anybody who is here in the Gambia, we must save your life from hepatitis-related complication. And this is the goal. And I think it is an objective that we can achieve. This is why the team today is time for action. So we have to act. We have to act, and we have to do everything. So with the help of the stakeholders, I think there are a few things that we can do. And those things, Sirif has mentioned them, Dr. Dow has also mentioned them. But we need all hands on deck. Everybody needs to be on deck. We need to do a seroprevalence study to know the extent of the disease in the Gambia. So this is one of the things that we have to do. Number two, we should make sure that there is provision for diagnostic and treatment in this country. We cannot always say, okay, we have to rely on MRC. No. Government has to come in. Private sector has to come in. NGOs have to come in. All other UN institutions also have to come in. Because you never know who is going to be the next. The next individual could be me, could be anybody. So we have to do something to save the lives of everybody. So that's why we have to provide diagnostic, we have to provide treatment. We know that it's not a cure, but at least there is a treatment. We also thought that the Sirif mentioned is like the birth dose, it has to be emphasized. Because mother to child. Can you imagine I saw a 17-year-old boy, who actually came to us. I looked at his vaccination card. Birth dose was actually given 28 days. He had all the 3 vaccines. All the 3 vaccines were given to him. But the birth dose was given 28 days after. So the patient had liver cancer. And what is our birth dose rate here? It's 41%. This, for me, is not a joke. We have to increase our capacity and make sure that birth dose is actually given within the first 24 hours. Because the next victim we don't know. So this story, you give somebody birth dose, not within 24 hours, the effect also goes down. So please, let's emphasize on this. The fourth thing is As health workers, we also have to need to protect our health workers, isn't it? Because the health workers also need to be healthy. So this is why I think one of the things we need to do, we have already done a pilot on that screening and vaccination of all health workers. We can start with them. 6,000 people, it's not difficult. We can vaccinate all of them. We can test all of them. Those who are at risk, because they are at high risk. Because this is a high-risk population. It's not only HIV, it's not only TB, it's not only diabetes, no. Or other key population areas, no. But health workers also are a high-risk group. And we need to protect them. And I think if we protect them, this is going to save us a lot of money. And we will be able to take care of the general population. So imagine a young man who is just 40 years dying. And this young man could be a lawyer. I've received lawyers, I've received magistrates, I've received nurses, I've received directors. And they have all died. So this disease has no boundary. Whether you are young or you are old, whether you are poor or you are rich, it doesn't have boundary. It can get to any of us. So in conclusion, I want to thank everybody for coming. And I hope that all stakeholders will join hands together and help Sirif. Sirif, your task is executed. It's not easy.